Three, two, one, live.
Hello and welcome to Wellness Live. My name is Dr. Olivia Moses, and this broadcast is brought to you by Loma University Health's Department of Risk Management. We want to thank you so much for joining us. And if you're joining us live, couple of things. Number one, you can ask questions live directly to our guest speaker today. So go ahead and type your questions into the chat box if you're watching us on YouTube or our website. But we wanted to welcome you today. And also, if you're joining us live, it is November, and November is uh, basically a very great month. Not only do we have Thanksgiving, but it is Epilepsy Awareness Month. And this is a perfect time to have our guest speaker talk with us about wellness, epilepsy, and seizures. His name is Dr. Travis Losey. He is the chair of our neurology department here at Loma University Health. And I am so excited for many reasons. Number one, he's the chair of neurology here at Loma, but first met we first met in Massachusetts, and we were definitely not where we are now. We re-met again in Loma Linda. We went to college together at a college named Atlantic Union College. So without further ado, I'd like to introduce you to the chair of our neurology department, Dr. Travis Losey. So Dr. Losey, you can go ahead and share your screen and get started.
Very good. Thank you very much, Dr. Moses. It's wonderful having an opportunity to share about epilepsy, especially in Epilepsy Awareness Month. And I'm looking forward to also hearing from the audience and answering questions. First of all, some really important background. What is epilepsy? So epilepsy is a condition that is characterized by recurrent unprovoked seizures. Epilepsy is common. Over 1% of the population at any given time meets criteria for a diagnosis of epilepsy. And epilepsy is a condition that can begin at any age. Younger people and older people are a little bit more likely to develop epilepsy, but there are definitely people at all stages in life who develop this condition. At times, epilepsy can occur in people who have other brain conditions, such as strokes, brain tumors, or birthmarks on the brain, what we call cortical dysplasias. But at other times, epilepsy is the only condition present. And can occur in people who don't have any other neurological concerns. As we talk about epilepsy, really the next question that comes up is, what are seizures? So while epilepsy is a disorder caused by recurrent unprovoked seizures, a seizure is an event. And at times a seizure can be provoked, which means it's caused by something else. And at other times, a seizure can be unprovoked and can occur spontaneously. A seizure is a sudden, uncontrolled burst of electrical activity in the brain. And 1 in 40 people will have a seizure at some point in their life. The symptoms from a seizure can be variable, and they really depend on the part of the brain that's involved in the seizure. In people who experience provoked seizure, there are other conditions that can cause them. Hypoglycemia commonly causes seizures, but other conditions such as acute head injury or alcohol withdrawal can also cause a person to experience. And another question that often comes up is, what can the symptoms of a seizure be? And to really answer that question, we want to look at the brain. Our brains are organized so that different parts of the brain have different functions. So this schematic, I think, is a really good introduction to that. Parts of the brain in the frontal lobe control movement. Movement of our hands is in different parts of the brain, the movement of our arms. Other parts of the frontal lobe are associated with attention, planning, decision making. More posterior parts of our brain process touch and vision and hearing. And when a seizure involves a particular part of the brain, it causes the symptoms that part of the brain governs. So a seizure that involves a part of the brain that controls movement can cause a person to experience stiffness or shaking of a part of the body. A seizure that involves a part of the brain that controls vision can cause a person to experience an unusual visual phenomena that's not there. And likewise, a seizure that involves a part of the brain that controls memory can cause a person to experience deja vu, or a feeling that something is familiar that really isn't. At times, seizures will remain confined to a part of the brain, so a person will only experience the symptoms of a limited part of the brain. But at other times, a seizure can spread to involve both sides of the brain, or even start involving both sides of the brain from the beginning. And when seizures involve both sides of the brain, a person can experience symptoms involving both sides of the body. For example, stiffness or shaking of the entire body. But what's important to remember is that different people can experience different symptoms from a seizure, and not all seizures are the same. Another thing that's important to remember is that a seizure can start with certain symptoms and spread on to involve symptoms involving a larger part of the body. We often call those focal seizures that spread to be generalized seizures. Most seizures last less than 2 minutes, though if a person is experiencing a seizure, it can really seem to be much longer while a seizure is occurring. Like many medical conditions, there are mimics to seizures. Common mimics of seizures. Sometimes that occurs when a person experiences strong emotions, which can affect how the body regulates blood flow to the brain. Sometimes that can occur when a person changes position and the body has trouble adjusting to that change in position. In the hospital, a common occurrence would be if a person experiences strong emotions while their blood's being drawn. Sometimes that can occur in the hospital and cause a person to experience syncope or fainting. Interestingly, sometimes when people experience fainting, there can be shaking of the body, and that can be confused with a seizure. Another condition that can mimic seizures is a condition called psychogenic non-epileptic spells. These are unconscious events that often occur in persons who have experienced really traumatic experiences in the past. And non-epileptic spells can at times involve shaking of the body that can also be confused with seizures. There are tests that can differentiate between those conditions, and the history, listening to a patient and what they've experienced can be very helpful in differentiating between these conditions as well. We have a number of treatments for epilepsy, and it's a really exciting time to be a neurologist because we're able to bring these treatments to many of our patients. We generally start with medications, and medications can fully control seizures in about 2/3 of the people who have epilepsy. When medications don't control seizures, there are other treatments such as surgery that can be curative. And a little bit later on in the talk, we'll discuss some of the evaluation that takes place in people who are candidates for surgery. And one of the newer treatments for epilepsy are computers that can be placed in the brain, or nerve stimulators that can reduce the intensity and frequency of seizures. Some of these devices are devices that actually respond to changes in the brain. So the computer can monitor brain activity and detect when a seizure pattern is starting. And at that point can have an intervention where the computer disrupts the circuit that's causing those seizures. So it's a really exciting time in epilepsy to have all of these new treatments and opportunities to help patients affected by epilepsy. And so now I think is a really great time to see if there are any questions.
Okay, well, thank you, Dr. Losey. If you, again, our audience, if you're watching us live, please feel free to type in your questions as we are happy to address them. So, Dr. Losey, just a quick question for you. I think a lot of people have never seen someone go into a seizure, and which is probably a good thing if they don't know what to do. So, one of the questions I had was, usually when we see one on TV, someone kind of falls to the ground and has uncontrollable body movement. And so what can you describe, and you talked about the different types of seizures, can you tell us what another type of seizure would possibly look like? give an example?
Yeah, that's a good question, Dr. Moses. So another common type of seizure would be a seizure that starts in the part of the brain that controls movement, what we call the motor cortex. And when a seizure only involves that part, it can cause extra movements. Often those movements would either be stiffness or shaking of a single part of the body, often the hand or the leg. In some people, that stiffness or shaking of the hand or the leg is the only symptom, and it can last for seconds to up to 2 minutes. But sometimes stiffness or shaking in one part of the body can spread. So, for example, if it were to start in the hand, it can spread to involve the leg. And then over time, in some patients, can spread to involve both sides of the body after. Sometimes a very small part of the body is involved when a seizure occurs.
Okay. Well, let's get to some questions. So, my child had a seizure when they were young, and we were very scared, not knowing what to do. What advice do you have to parents on education they should have if a child has a seizure?
That's a really good question. The first step is seizure first aid. So if a person is experiencing a seizure, whether they're an adult or a child, the best way to help that person is to help them to lay flat on their side. And by laying flat on their side, a person is able to breathe more safely and reduce the risk of aspiration. And by helping them to lay down, we reduce the risk that a person could experience a fall. There's no need to hold a person down, and there's no need to put anything in a person's mouth while the seizure is occurring. And then the second thing to do is to time the seizure. I think for any of us, when we're with a person having a seizure, it seems like a very long time, but most seizures last less than 2 minutes. And as long as the seizure lasts less than 2 minutes, if a person has a seizure similar to others that they've had before, there's no need for additional interventions. But if a seizure lasts for more than 2 minutes or they're back-to-back seizures, that would be a time to call 911. And then if a person has experienced a seizure for the first time, it's important that they be evaluated to make sure that there's not another medical condition that's contributing to the seizures. For example, an infection or another condition affecting the brain. And so that would be a time to seek medical attention to rule out additional conditions that could be present.
Okay. Another question, when a person has a seizure, do we automatically call 911 or do we just let it resolve?
That's a good question. Again, if a person has experienced seizures before and the seizure that they're experiencing is similar to others, there's no need to call 911 unless a person's seizure lasts for more than 2 minutes, or if they have back-to-back seizures without returning to themselves, or obviously if they were to suffer an injury during a seizure. If a person's experiencing a seizure for the very first time, then it would be reasonable to call 911.
Okay. Another question is, can a child grow out of epilepsy?
That's also a really good question. There are many causes of epilepsy. Some of the causes are genetic causes that a child can experience at a certain time of brain development that they can grow out of. And so working with a pediatric neurologist to understand what's causing each individual's seizures is important. And in children, there are definitely cases where children can grow out of seizures.
Okay. And on the flip side, can someone have epilepsy very later on in age?
Yes, absolutely. Epilepsy can begin at any age. Again, in younger people, it's often related to changes in brain development or genetic causes. In older people, it can sometimes be related to small strokes or other changes in the brain that occur later on in life. But seizures can begin at any age.
Okay. Well, thank you, Dr. Losey. And I just want to remind our audience, if you have any questions, go ahead and type them in. And why don't we get to the second half of your presentation?
Oh, thank you.
And maybe if we could go on presentation mode, that would be great if you could.
Oh, thank you so much. Very good. One of the important, aspects of care for epilepsy is really addressing the whole person. And this is a schematic that's been shared by the Epilepsy Foundation, which is a wonderful resource for helping persons with epilepsy, that really illustrates that wellness in epilepsy involves many different domains. Diet and nutrition are important. There are certain dietary factors that have been shown to be protective against seizures, including diets that limit the amount of carbohydrates, including diets like the Atkins diet or the ketogenic diet. Emotional and spiritual health are extremely important. Epilepsy can be an unpredictable condition, and so there are risks of anxiety and depression with the condition, and making sure that those are addressed is very important. Independent living, seizures are sporadic in many cases, but well controlled in others, and making sure that we address any barriers to independent living is important. Physical activity is extremely important, not only for overall health, but also for stress management. Education is important, and employment are really key features in supporting people with epilepsy. Epilepsy can affect many domains of a person's life, but our goal is always to really work with our patients to make sure that they're able to achieve the educational goals that they have and maintain employment and continue to contribute to their communities. Social relationships are important. Epilepsy can cause disconnections, and making sure that people feel the strength of their communities is a key factor for treating the overall condition. Sleep is especially important in epilepsy. Times when a person's sleep is interrupted can be associated with increased risk of seizures, and also increased risk of anxiety and other mood changes. Stress, again, is a tremendous opportunity for us to impact the course of the disease by reducing stress in people with epilepsy. So overall wellness is very important. We talked a little bit earlier about the difference between provoked and unprovoked seizures. So with provoked seizures, and these are seizures that occur due to another cause, there are key steps that we can do to help to prevent provoked seizures. The first is in people with diabetes. It's important to make sure that blood glucose does not dip too low, because that can cause seizures and other serious neurological problems. Alcohol withdrawal can cause provoked seizures, so making sure that we avoid situations where alcohol withdrawal can occur and avoid excessive consumption of alcohol is important. Again, sleep deprivation can occur. It can cause seizures in susceptible individuals. Head trauma is a cause for seizures, and so making sure the person takes the appropriate safety measures to reduce that risk when undergoing or undertaking high-risk activities is important. And interestingly, excessive consumption of energy drinks can at times cause seizures. So ensuring moderation in caffeine intake is also important in reducing the risk of provoked seizures. Wellness can also be important in preventing epilepsy. We talked in the question and answer session about how, especially as we go through life, stroke can be a risk factor for epilepsy. So making sure that we really ensure our overall cardiovascular health is important with a healthy diet, exercise, regular sleep, and addressing conditions like hypertension that can be a risk factor for developing stroke is important, and as well as avoiding excess alcohol. So these are really the wellness steps that we can take to prevent seizures and prevent epilepsy. I'd also like to circle back and talk a little bit about how we evaluate and treat epilepsy. So we discussed how medications are really the first line treatment for epilepsy. And we're able to fully control seizures in about 2/3 of people with epilepsy with medications. When medications don't control seizures, though, we do have a wealth of treatments. And we're very fortunate here at Loma Linda to be a comprehensive epilepsy center that offers the full range of treatments for people with epilepsy. When we're evaluating people with epilepsy, one of the first tests that we do is a test called an EEG, which is a test where we record brain rhythms. And often we'll be able to correlate what we see in the brain with the video, which we call a video EEG. In this slide, we see the EEG recording of a person who's experiencing a seizure. And on this slide, we see that the seizure is involving the right side of the brain, which is towards the middle of which is about 1/3 down on the slide. And as we go left to right, we can see the seizure pattern that's building and becoming more organized. And this is an example of a seizure affecting the brain on an EEG, and helps us localize where the seizure is occurring in the brain. On the next slide, we see an example of an MRI in a patient with epilepsy. And in this slide, we see what's called a PET scan. And in the PET scan, we see the bright signal of normal metabolism on one side of the brain. But on the other side, the right side of the brain, we see that there isn't that normal metabolism. And that tells us that not only is the seizure coming from the right side, but that's a part of the brain that is not working at its best between seizures. And those factors together not only help us localize seizures, but tell us that this is a case where surgery to remove part of the brain may be an effective way of helping to treat the seizures. Functional MRI is a test where we look at the activity in the brain to see what parts of the brain control certain functions. This is a test in a patient with epilepsy. We're able to see that the brighter areas on the left side of the brain indicate that's where language is functioning. And the lack of that activity on the right tells us that that's the side of the brain where language is not actively involved, and again tells us that epilepsy surgery could be an option. And in this last slide, we see an example of a person who's had epilepsy surgery. And so again, this is the right temporal lobe. We can see where a surgical procedure has been performed that removed the part of the brain that was dysfunctional and causing seizures. And this is the type of surgical procedure that can completely stop seizures and be curative for many people. And so this, again, is an illustration of the types of treatment that are available for people with epilepsy when medications don't do everything that we want them to. So very good. So thank you very much, Dr. Moses, for the opportunity to share. And I'd love to answer any more questions that have come up.
Thank you so much, Dr. Losey. I have a question, but let's get to other people's questions. I could ask you a bunch of questions myself, but you kind of went over this already. But the question is, what is the first tip to do if someone is having seizure? If they do one thing, if someone's having seizure, what should that thing be?
Yeah, so really the first step would be to help a person lay flat on their side. So in most cases, that would be laying flat on the floor. Sometimes we care for patients in the hospital who are in, padded hospital beds, and in those cases, we would help them to, lay on their side in the bed. So helping a person lay on their side and, reducing the risk of any sharp objects or hot objects around them as they lay on their side would be the first step.
Okay. Well, I'll ask my question. What is the experience of a person having a seizure? Do they remember going into the seizure? Do they remember what is happening? Is it painful for them? Can you kind of walk us through the process of what someone would experience?
Yeah, that's a good question. It really depends on the person and what parts of the brain are involved. So if a seizure only involves a small part of the brain, then a person can remember everything that happens in a seizure. If a seizure involves both sides of the brain or spreads out to involve both sides of the brain, then a person will lose awareness and not remember that part of a seizure.
Okay. Well, in closing, what I want to ask, if we can do a kind of final summary. I think when people hear about these conditions, they get concerned on what can I do to prevent these conditions, and that's what we try to promote here in Wellness Live. Can we have a summary from you of what a person can do in their lifestyle, or anything that they can implement in their life now that could prevent maybe this from happening to them?
Yeah, so for a person who has never had a seizure, really the important things to reduce the risk of developing seizures and epilepsy in the future would be, first of all, to take all of the important steps to ensure good cardiovascular health. So that would be managing diet, managing exercise, and making sure that high blood pressure or diabetes are appropriately treated. The second big thing would be to make sure that a person avoids excess alcohol or obviously any recreational drugs that affect the brain, because those can increase the risk of epilepsy. And really the last one is to ensure regular sleep.
Okay. Well, thank you so much, Dr. Losey. I don't think epilepsy is one of those conditions that we talk a whole lot about, so I think this conversation is very important. And we know your time is valuable, and thank you for donating it to us today. And I also want to thank each one of you who are in our audience today for joining us for Wellness Live. We are so appreciative of your time and joining us in educating ourselves when it comes to wellness and these types of conditions. We don't want to miss having our last Wellness Live, which is next month. So we hope you join us then. My name is Dr. Olivia Moses, and we'll see you next time.